Hi, and welcome to my second video blog. Today I'm going to be talking about the 5 common myths around dental disease. Hi, so I've decided to be Dr. Belinda's tooth fairy, and I'm going to help you with these 5 myths that are surrounding dental disease. Myth number 1, my pet can't possibly be in pain because he's eating fine. Thank you, Tooth Fairy. So that would be one of the most common things that I hear is that, oh, but he can't be in pain because he's eating. Well, that's not true. The reality is that animals have such strong instincts that they're going to eat even if they're in pain. And they have to get to a point where they're in so much pain that they would rather starve to death than eat. Can you imagine being in that level of pain? So dental disease certainly is painful, and I have a lot of clients that say to me after their pet's teeth have been cleaned that they say, oh my gosh, and I did not realise how much pain he must have been in. He's acting like a young puppy or kitten again. And so yeah, animals are incredibly good at hiding their pain. So just because they're eating doesn't mean that that rotten tooth is not hurting them. Myth number 2, bones are good for my pet's teeth. Ooh, good question about bones and pet's teeth. So not everyone is going to agree with me here, but I don't recommend bones to help keep your pet's teeth clean. And there's a few reasons why I don't recommend bones. There's no scientific evidence that have proven that bones will help to keep your pet's teeth clean. And there are quite a few risks involved with feeding your pet's bones. So one of the most common things that we see is fractured teeth because dogs have been chewing on bones. So, you know, those really long bones on cattle, they're designed to hold up a half-ton animal. So what do you think is going to break first? The dog's tooth or the bone? There's a very large chance that your dog is going to end up with a slab fracture on their tooth, and then that's going to cause them pain and it can lead to infection and abscessed teeth afterwards. I saw a dog who is lucky to be alive, who choked on chicken neck that got stuck in its throat. It resulted in a tear in her esophagus, and she was in hospital for 4 or 5 days, incredibly unwell with it. So we've literally seen animals die from eating bones, or nearly died. They can also get really terrible gastroenteritis. So one of my good friends, her dog, she had some builders over and she thought, oh, I'll just give her some bones and that'll help to keep her entertained while the builders are there. It resulted in severe constipation, severe gastroenteritis, and an over $2,000 vet bill. So it's really not worth the risk of giving them bones, in my opinion. So the other thing that we see obstructions. So bones can get stuck in their intestines and perforate. If they're sharp bones, they can perforate the bowel, which is terrible. And yeah, I can't imagine anything worse than being constipated with bones. Those poor dogs' bottoms and rectums are just so damaged by all the bone that gets stuck in there. So yeah, my recommendation is not to feed bones, especially when there are many other alternatives that are far safer for your pet. Myth number 3, but my pet's too old to have an anaesthetic. Ooh, pet being too old to have a general anaesthetic. So everybody who knows me knows my dog, Jack, is ancient. My dog, Jack, is 19 years old. He has kidney disease, he's in kidney failure, and he also has a heart murmur. And he's had 3 dentals in the last 12 months. So being old is not reason not to give an anaesthetic. Obviously, we change the anaesthetic protocols that we use. We do things to make it safer for them as they get older, but age is not a reason why you wouldn't give them an anaesthetic. So with my boy Jack, he obviously, for his quality of life, it's far more important to me that he has a comfortable mouth. So that has meant that he's had 3 dentals in the last 12 months. And so yeah, he always pulls through the anaesthetic fine. No anaesthetic is ever 100% safe, but there's a lot of things that we can do these days to make it safer than it has been in the past. So we're monitoring blood pressure throughout. Jack's on a drip for 24 hours before the procedure and 24 hours after the procedure. He gets different drugs that don't lower his blood pressure as much, and all those sorts of things. So certainly age is not a reason why I would say no, you can't have an anaesthetic. Myth number 4. I've heard the safest way to clean my pet's teeth is to do it without an anaesthetic and using a hand scaler. So yes, I have heard of these people who will use a hand scaler to clean your pet's teeth while your dog is awake, and I do not recommend it. There's a few good reasons why I don't recommend hand scaling the teeth. Basically, it's a cosmetic thing, right? It's getting rid of the tartar that you can see, but it's doing nothing for the tartar and the gingivitis underneath the gum line, and that is where the real dental disease is. You also can't clean the inside surface of the teeth, the surface along the side of the tongue, by using a hand scaler. And often it is that side of the tooth where, you know, there might be pocketing that you're not aware of. A lot of dogs are getting restrained and it's inducing a fear response in them. So they go into that freeze mode and they will just lay there and let it happen because they're so terrified they don't know what else to do. So whilst, yes, you can cosmetically improve the look of the tooth, it doesn't actually do anything to stop the dental disease from progressing. The only thing that's going to clean off clean under the gums, which is the most important part, is having a general anaesthetic, using an ultrasonic scaler and getting up underneath the gum line, because you can't do that in an awake dog, and if you can, it's going to be painful and they're not going to tolerate it and they'll never let you open their mouth again. So yeah, so I do not recommend doing that. No, no, no. You also can't do dental x-rays, and dental x-rays are really important at identifying any potential early abscess, tooth root abscess formation and things like that. So I'm going to flick up some pictures here of some x-rays that I've done that show you. It might look like a healthy tooth on the outside, but you can't tell what's happening under the gum line without doing some dental x-rays.
Myth number 5. There's no point in cleaning my pet's teeth because they're just going to get dirty again.
Okay, so no point in cleaning their teeth because they're just going to get dirty again. Yep. That's how it works. So basically what happens is if you were to brush your teeth one day and then never do it again, then you're going to end up with getting dental disease. So yes, you do have to do regular scales and polish on your pet's teeth, but that's to help keep their dental hygiene where it needs to be. If you're going to be committed to brushing their teeth twice a day, every single day, then you may not need to have any dentals. Your pet may not need any dentals, but certain breeds are more prone to dental disease. So the smaller breed dogs are much more prone to dental disease. There's a genetic component, there's a dietary component. So depending on what food you feed your dog, it means they're either more or less likely to develop dental disease. So if your dog was only ever eating wet food and that's just sitting around on the mouth sticking to the teeth, they're going to have a far higher degree of dental disease than if they were eating, you know, more a dry food diet that's helping to mechanically, like when they crunch on the food, it helps to mechanically clean their teeth. So yeah, dental disease does come back. It's one of those things, it's a maintenance thing. So, but if you keep doing scales and polishes when your pet is only at grade 1 or grade 2 dental disease, hopefully you'll be able to avoid them needing any teeth extractions and they will have a pain-free, healthy mouth for a long time. The reason why it's so important to treat dental disease and not just let it get to the point where the teeth are rotting out of the head is that if you've got large infection in your mouth, that can spread through their bloodstream into their heart. It can affect their liver, it can affect their kidneys, it can cause pain, they can get abscesses in their mouth, and that can affect their overall well-being. So if you want to have a happy, healthy pet, the best thing for them is to make sure that their mouth is kept nice and clean and healthy.
And a final message from Dr. Belinda's Tooth Fairy would be that bad breath is not normal. It's not normal doggy breath. If there's a smell, that's because there's infection there. So I hope you've enjoyed busting these 5 myths with me. As you can see, I really like filters. I have a slight problem. I'm going to brush Jack's teeth.